Thank you. Thanks for having me. I'd like to talk about actually something a little bit different, reframe the question. I'd like to talk about creating a culture that creates value at speed. So I think that is the primary question that we're wrestling with. How do we create value at speed? Well, I'll give you two examples of value. I think it'd be defined differently, but we're a pioneer participant. We're a pioneer ACO with our partner ThedaCare. We are the best performing pioneer of the 32 pioneers. Independent study just came out. Actually, we're the lowest cost per member pioneer of the 32, have the best quality and best experience. $8,000 per member. The average pioneer is $2,000 more than that. I would argue that we've created value for the government. We've provided a value product at a lower cost. Let me give you another example. I'm going to talk about an individual, an employee of ours actually. Mary. Mary came up to me, as she does many times as I'm working out at our fitness center, which Mary does too. So happy. She lost 150 pounds, doesn't drag along her oxygen tank, and achieved a dream of hers last year. She traveled to Ireland with her daughter. That's creating value for Mary. You know, I think we sometimes forget that value is defined by the customer, by the patient. And we've talked a lot about basic value. I'll call it basic value. And that basic value is we won't hurt you when you come into our system. Real value is delivering to a customer or patient something that's important to them. So I've been at Bellin for 34 years working with our CEO. We've been on a journey for 34 years trying to understand how we create value at speed. The interesting thing is I've written books about this subject and looked at the research is that organizations around the world fail at this 70% of the time. Doesn't matter which industry. So 70% of the time, we fail to implement our strategies successfully. That's been our journey, trying to understand how we overcome those odds and actually change the odds in our favor. So all of the nice things we talk about wanting to do are generally going to fail because we don't execute effectively. We don't have a culture. We don't have the systems and structures in place in our cultures to support execution at speed. What does it require? Well, we believe an organization that can deliver value at speed requires intentionality, discipline, focus, and what I'll call rhythm. And it is what Dr. James talked about yesterday, and in our terms a little bit different. He talked about bandwidth. We talk about managing energy. Energy's a limited supply in our organizations. We have a limited supply of energy. The question is how we're going to use it. Can we align the organization around a value proposition and deliver on that value proposition using the energy we have? I would argue, based upon the topic of this program, that unless we can align research around that value proposition and help organizations deliver value, that we won't integrate research in practice. That is the big question that we have in our organization, and I think all healthcare organizations have today. How do we create value? How do we differentiate ourselves? How do we deliver an insurance product at $2,000 less than everybody else? And guess what? We want to be paid for that. And we aren't today. So I'm going to maybe talk about some structures. And if any of this is interesting, we can get into it in Q&A. This is a framework that I wrote about first in the year 2000, have been working on it ever since, have worked with health systems in the US and Canada and Europe to implement this. We've been working on it at Bellin for many years. We would suggest or probably propose that any organization that executes effectively has to be thinking about these 6 variables. First variable is a strategic dimension. How do we listen to the market, understand the value proposition, and prepare the organization to focus on the important priorities that our customer and patients are asking for. Second dimension is production system. Yes, production system, we do have a production system. I'll talk about that. a little bit, but how do we actually deliver on the specifications that we've understood from the market and our customer? Then a system of measurement. How do we overlay measurement so that we understand how our system is performing? And then a system of improvement, and only then a system of improvement. When I'm called in to work with health systems, this is usually the problem that I see immediately. They've jumped in at dimension 4. A lot of activity, tons of activity without the results that people are looking for. First have to frame this up, understand the market, understand how you're producing your products and services, know where your gaps are, and be very focused on where you spend your time and energy. This is where I think we have to align research if it's going to be relevant in the value equation. Lastly, we go out and sell and market our services. I was on the way here in the cab listening to the radio, heard a commercial come on. I hope the health system isn't here. The basic essence of the commercial, the ad was, we're a leading cancer center. At the end of it said, we're striving hard to be above average on our survival rates. I thought that I would not market that. I would not go out and market that. I can tell you that in our cancer program, we are much above average in our survival rates. But we went out and listened to customers and patients and families, and what they told us was, when you have a diagnosis of cancer, it's very hard to wait to know what my options for treatment are. And sometimes we're waiting 20 to 30 days for those answers. That is just not good enough. So we came back, we worked in our production system with all the physicians involved, and we went out and we made a guarantee in the market that we would give individual patients diagnosis to treatment options within 3 days. That's what we market. We market to a need that people said they had regarding that particular service, and I could go on. And we wrap that with a culture. How do we create a culture then that supports what we're trying to accomplish in creating value for our patients and customers? I'm going to run through very quickly some high-level view of this, and I want to integrate into one of the views research and how we think about it. This is that dimension number 1 for us strategically aligning the organization. We have defined 3 breakthrough initiatives. These, as one of our board members has said, are the bet the farm things. We cannot fail if we're going to succeed as an organization. We have to take cost out of our system. Today we're taking 5% cost out year over year. We have to manage populations for triple aim outcomes. We've taken those pioneer results. We now actually, we work with over 100 employers. We have services, primary care services on site at over 100 employers in our area, helping them to achieve the same thing we've done with the Medicare population. And then new business growth and development. How can we extend our products and services, expand what we do and how we do it? And we've doubled in size in the past 5 years, not through acquisition. These are things that we have to hit out of the park. Third column over, operational priorities. These are important things we need to do. We need to reduce infection rates in our surgery. We need to get ICD-10 done. We need to do a lot of things. Well, the point here is that we've focused the organization and said, this is what's important to us and this is what we're going to do. We align the entire organization around these things. I'm going to briefly talk about this. This is our new business development process. We think healthcare today is a land of opportunity. We're growing at a rate that's incredible. This is a process. We went out and we looked at worldwide best practice and new product development and implementation across all industries around the world. And what we found out is that we have to manage this process effectively. We have to identify value opportunities in terms of products and services for our customers, and we have to deliver those fast. And that's what phase 4 and 5 do. If this is an incremental increase, an improvement in a product or service, we have a goal of 0 to 60 days when we've got that defined and implemented and spread. If it's a new product, we're putting it in an incubator and we're incubating it and protecting it so that it has an opportunity to be successful. I want to move along. I want to talk about the production system. This is a picture of our production system from beginning to end. It is how we produce our products and services. I would point out on the bottom, the bar that runs across the bottom, our goal is to produce products and services across the continuum. We call it the connected experience across the continuum, to produce results like Mary had in her experience. The entire connected experience in creating value around things that individuals say are important to them. This is, I'd like to overlay, sorry about this, I'd like to overlay, I need to be pointing this at a certain thing, or, there we go. I'd like to overlay research. We think about research at 4 levels related to our production system. First is population research. We're in the midst of a 10-year agreement with the Green Bay Packers to improve the health of our community. We're developing with them a concept we're calling Titletown Research. And we're asking we think relevant questions about health in the community. We have 60% of our kids in the Green Bay School District at poverty level or below. We're asking questions like, how do some kids coming out of poverty succeed in school and why don't others? We need to know answers to those questions. At level 2, breakthrough research, we're running research on best practices in primary care around the world, and how do we take those and implement them in our organization. 3, microsystem, how do we improve care, clinical trials, things like that. And at the individual level, individuals, it's a requirement for anyone who works at Bellin today to be improving. It's part of their development plan process. Questions like, why don't my patients show up for therapy? And reducing no-show rates from 12% to 4%. These are relevant questions related to the value proposition. Then we manage energy. This is dimension 4. We run this on a rhythm of 120-day cycles where we get everybody in the organization, all the leaders in the organization together for every 120 days and recalibrate and redefine our priorities as we move forward. Every week, our CEO, CIO, CMO, CFO, name them all, every week we get together for 2 hours to talk about how we're managing organizational energy in our breakthroughs and operational priorities and developing the culture to support it. Then we have built a competency model where we are building competencies around the breakthrough initiatives. You can't say you're just going to do this and not help physicians and physician leaders and staff leaders accomplish or develop the competencies that they need now to operate in a world where we're managing health in a different way, managing productivity in a different way. So we built a competency structure, a model, where we're helping individuals develop the knowledge and skills they need to be successful as we travel through what we call the corridor from fee-for-service to managing health. Structures, I would just like to point this out and then I'll end. We have 2 structures. Our service delivery structure, it's built around the patient. We have a goal right now that patients are involved in every innovation and product development research project that we're involved with. It's not just words. It's in my performance plan. It's in the CEO's performance objectives. If we don't achieve that, we're going to get nicked on our bonus pay at the end of the year. So we have patients integrated everywhere in our system on the key things that we're involved in trying to make better and create better value. 8,000 people a day come through our service delivery structure in one form or another, and we need to deliver care in a reliable and predictable way for 8,000 people every day. The second structure we have is our project delivery structure. We morph the organization to wrap around those breakthrough initiatives and operational priorities because those things don't occur in the service delivery structure that we've created. We need to bring together people from all over the organization to accomplish our work. So we have 2 distinct structures that are designed to deliver service every day reliably and predictably to our customers, but then also achieve better and greater value each and every day. So that's a quick run through of creating what we believe is the culture, the discipline and structure for a culture that produces value at speed. So thanks very much.